Today's topic is addressing the syndemic of diabetes and obesity with the world's first peptide in a pill, that is oral semaglutide. These are the disclosures. So today's agenda I'll cover in four headings. One is the burden of weight in diabetes and benefits of GLP-1 unlocks, how this molecule has been coming to the market, oral semaglutide. This is a pioneering innovation in this peptide in a pill combination, and summarizing my talk. Coming to the burden, diabetes with obesity is called obesity. 67% of the people with diabetes in India have obesity. And because of this, there is a 7 times increase in mortality between the age of 51 and 61 years compared with those people with diabetes without obesity. So this is a huge, so even diabetes with a normal weight and diabetes with overweight, there is a 7 times increase all-cause mortality. So weight is a big factor, additional risk factors in patients with diabetes. Not only the risk of all-cause mortality, there is a burgeoning cost of increased weight. If you have overweight of a BMI of 25 to 29, there is 11% additional cost. And if you are obesity in class 1, that is 30 to 35, it's a 17% increased cost. And you are in 35 to 40 BMI range, that is obesity class 2, is a 29% increase in the cost. And in obesity class 3, BMI more than 40, it's a 46% increase in the cost. So increase in body weight leading to incremental direct cost in patient with diabetes mellitus. So we have heard the all-cause mortality. We have heard about the increased cost of the obesity in a patient with diabetes. A lot of other things are also there. Several comorbidities in a patient with diabetes: cancer, albuminuria, renal disease, depression, retinopathy, obstructive sleep apnea, and mobility. If you see, the incidence of cancer is increased by 34 in men and 31% in women in a patient with diabetes with obesity. Albuminuria is increased as a waist circumference increases, BMI increases, albuminuria increases. Renal disease in a patient with diabetes with obesity is a 5% increase in the end-stage renal disease. Depression, once the BMI crosses 30, there is a 3-fold increase in the depression. Retinopathy is a 64% increase in diabetic retinopathy in a patient with obesity. Obstructive sleep apnea, every 1 centimeter increase in waist circumference increase the obstructive sleep apnea by 10%. Mobility, people with diabetes and obesity, there are 6 to 7 times increased risk of mobility difficulty when compared to the patient with diabetes without obesity. So the high body weight can increase several complications. Again, they can be summarized here: cardiovascular and non-cardiovascular. Cardiovascular are cerebrovascular disease, cardiovascular disease, peripheral vascular disease. Non-cardiovascular disease are depression, hyperglycemia, osteoarthritis, obstructive sleep apnea, depression, GERD, urinary stress and incontinence, NASH. So coming to the second agenda is, what are the benefits of these GLP-1 unlocks? The GLP-1 unlocks have proven benefits: clinical efficacy, that is a highly effective HbA1c reduction, excellent body weight reduction, low hypoglycemia risk when compared to sulfonylureas or insulin, and cardiovascular benefits. They can be prescribed even if a person visits are not possible. Side effects like nausea are transient, easier to titrate compared to insulins in the clinical use. But what are the blocks? But the acceptance remains low because these injectable GLP-1 unlocks were available. Treatment adherence is difficult and optimal control. These are the problems with the injectable drugs. So increasing patient conveniency, the new drug, the oral semaglutide, which is available now. So many patients prefer oral over injectable medications, and oral drug may allow earlier initiation and increase adherence, thereby improving long-term outcomes. The challenge of oral peptides is the oral-based drugs. All oral drugs, as you know, they undergo enzymatic degradation, limited permeability, low oral bioavailability, and limited absorption. So how they manage is, the foundation stone for oral semaglutide was, they have attached the semaglutide to SNAC, And the combination of this is oral semaglutide. This SNAC, it adheres to the gastric mucosa, and out of 10 molecules of semaglutide, only 1 or 2 will be entering into the circulation, rest of them go into the GI circulation. So oral semaglutide, it's a combination of 300 milligram of SNAC, and that's how this pill in polypeptide is manufactured. That's how this peptide doesn't degrade in the stomach. The co-formulation does not change the chemical structure of oral semaglutide or SNAC, and they remain as distinct entity. That's how they could manufacture the oral peptide. This oral peptide semaglutide is approved in India. The indications are for treatment with type 2 diabetes mellitus, improve glycemic control or adjuvant to diet and exercise. As a monotherapy, when metformin is considered inappropriate due to intolerance or contraindication, in combination with medicinal products for treatment of diabetes. It's approved in India for more than 18 years of age, in monotherapy or combination use, special population, hepatic or renal impairment, and it's a cardiovascular safe. How a oral semaglutide should be administered? This is a very important point. They are available in 3 doses, 3 milligrams, 7 milligrams, and 14 milligrams. The first month you have to start with 3 milligrams per day, and then escalate to 7 milligrams. And if you get the desired results of sugar control and adequate therapeutic targets are there, don't escalate to 14 milligrams, continue with 7 milligrams. And if you have not got adequate therapeutic control, and escalate those to 14 milligrams. Most important thing is how this drug has to be taken. The drug has to be taken in the fasting stage, and first on waking up in the morning, the drug has to be taken with only half glass of water. That is only 120 ml of water. Even if you take more than 120 ml of water, the tablet will be flushed into the intestine and jejunum and will not act. So many of the people who taking semaglutide, the patient comes, I'm not having any benefit. This is one of the reasons you have to keep on telling this patient that you have to get up in the morning, not more than 120 ml, and wait for 30 minutes before you start taking any tablet. That's very, very important. And the first meal of the day should be taken after taking other medications. For example, if the patient is taking a thyroid medication along with a semaglutide, you can tell them that you can take thyroid medication post dinner 3 hours the previous day rather than early morning, because if you take thyroid and this pill together, the efficacy of the semaglutide will be affected. The factors decreasing semaglutide exposure are food intake prior to dosing, increase water volume, and decrease post-dosing fasting time. You should be fasting for 30 minutes post these tablets. Otherwise, the drug will not work. Coming to the summary of all the talk today, obesity and overweight in type 2 diabetes can increase risk of various complications and rise in healthcare cost. GLP unlocks provide multiple overarching benefits: HbA1c reduction, weight loss, and reduction in cardiovascular risk factors. Clinical use was limited due to injectable route of administration, which was earlier. The clinical inertia is there. Food adherence is a poor adherence. Oral semaglutide is a path-breaking biopharmaceutical innovation that allows for delivering the benefits of GLP-1 unlocks in a pill form. Thank you.